When people enter the medical or rehab or even fitness world, a lot of times they don't know where to start. And whether it's they come in on the fitness side, they're looking for the best exercise program. If they come in on the PT world, do they just need somebody to pop something back in place? Do they need some deep tissue? Do they need corrective exercise? All the way down to the medical where it's like, do I need surgery? And so I just made this model to sort of integrate all these things together into one sort of cohesive way to think about it. So if you imagine the pyramid sort of as your function, our goal is to have as big of a function as possible. And so that means we need a big base. And so it starts with really your health status. I would include relationships, emotional, psychological, spiritual in that as well. But also stuff like sleep, diet, hydration, do you have some underlying medical issue? All of those really make the base for the potential for our function. So I consider that the fundamentals of health. Immediately above that is where sort of physical therapy would be. I consider that the fundamentals of physical function. And so if the whole pyramid is your function, that would be integrated. Your body's working as a unit, all of those systems working together to accomplish a goal. Then this basics of physical function would be the disintegrated function. So that means if you're trying to make banana bread, you need a certain amount of ingredients. So if you need 3 eggs to make some banana bread and you only have 2, you don't get banana bread. Similarly with our function, if you need a certain amount of mobility, stability, control, strength, endurance to do a particular thing, say run a marathon or lift a weight or even just get up off the floor, pick up your kids, and you don't have those ingredients, something is going to break down when you try it. So as far as I'm concerned, disintegrated function, what those ingredients include are the mechanics. So can all the parts move? And that could be joints, soft tissues, muscles, ligaments, even neurovascular structures, your abdominal, viscera, all the guts in your stomach, all of that stuff needs to have the potential to move. So that's one. 2 would be the neuromuscular control. So I would say that first part is kind of like the hardware. The second piece is sort of the software. So just because you have the potential to move doesn't necessarily mean your body knows how to use that. And we really learn that through developmental patterns. So we can take our high-level movements that have broke down and regress back into those earlier developmental phases, shore up those weaknesses, and then put them back in the higher level function. And so that's what I would consider the sort of software. Lastly is the motor control. Can I take that potential to move on the mechanical side? Can I train that local pattern that became dysfunctional? And then lastly, put strength and endurance on top of that. So then you have sort of the components to move, and then you have to reintegrate that back into your function. And that's sort of that next layer of the triangle, and that would be kind of the general preparation, general physical preparation. So just starting to condition those tissues to handle a particular load, and I love strength training, and it's a very general way to address the conditioning of those tissues. And then the very top would be sort of your sport or your function, whatever the thing that you need to demand of your body, the specific. So it goes from very specific at the top down to very general at the bottom. And we just want to make those layers as thick and as wide as possible so that our function can be as high as possible. And when you integrate all those together, you're not looking for a magical fix. You're finding where are my biggest deficits and what can I do about them, versus going in on the medical side, just trying to do surgery or do injections to just limit pain, to do corrective exercise for the rest of your life, which is not going to help you necessarily function at your highest level, or just do strength training on top of a bunch of dysfunction.